More than half of all states in the U.S. have reached the White House's goal to partially vaccinate 70% of adults against COVID by the 4th of July. Here to explain what that could mean for your health is Dr. Robin Colgrove, an infectious disease specialist at Mount Auburn Hospital. Thanks especially on this holiday Monday for being with us, Dr. Colgrove.
My pleasure.
Well, so the country seems really geographically split right now, correct? In terms of vaccinations, rates in the Northeast, they're high compared to the South and West. So what's really the risk to Massachusetts if other states such as Mississippi, Louisiana, they have outbreaks? What does it mean for us?
Yes, it's frustrating. If the rest of the country were as high vaccination rates as Massachusetts, the epidemic would fade out on its own because the virus wouldn't be able to transmit itself. But because there are areas with much lower rates of vaccination, even though vaccination rates are high in Massachusetts, we'll keep getting pummeled by infected people coming in from elsewhere. So that means we need to keep our guard up and try to keep people and encourage people to get vaccinated elsewhere in the country.
So we've spoken a lot about the Delta variant, but public health officials in Washington state now say they have new concerns about the Gamma variant. What can you tell us about that? And are there any cases in Massachusetts?
Short answer, yes, there are cases in Massachusetts, and everything is everywhere. The world is one place now. So there's no place safe from the rest of the world. We're all one big world as far as the viruses are concerned. The Delta variant is the one that is increasing most in rates and is either now or will soon be the major variant. But in Massachusetts, we've also seen the Gamma variant first picked up in Japan from people returning from a vacation in the Amazon, but really first seen most in Brazil. And this variant is worrisome because it does grow to higher titers in people, and it can provoke more serious disease. The vaccines do have somewhat lower efficacy against it, although the efficacy against severe disease is still good. But it is a concern because it can provoke more serious and high-level infection.
And of course, as the virus continues to spread or circulate, we can have these variants, and that's the trouble. Okay, so we've also learned today that Catherine, Duchess of Cambridge, she's self-isolating after being in contact with someone who later tested positive for COVID. Is that surprising? We know that she's fully vaccinated. Are the rules in the UK different from the US? What's really her risk?
Yeah, so I can't comment on any individual person since I'm not her doctor, but the rules do differ from country to country, and that's something that's important for people to know. And each country has to make its decisions about exactly where the balance lies. So here in the US, from the CDC and the Mass Department of Public Health, vaccinated people are not required to, we would say, not isolate, not required to quarantine, which is what you do if you've been exposed but are not known to be infected. You're not required to quarantine after an exposure if you're fully vaccinated.
Okay. Well, Dr. Colgrove, again, thank you, especially on the 5th here, for being with us, and hope you had a great holiday.
Thanks a lot.